Hello everyone, I'm Scott Gregg. Well, the statistics suggest that a fairly large percentage of the American population has some crooked teeth, which probably suggests that a lot of us should see an orthodontist. What kinds of questions should we ask the orthodontist? Well, joining us today is Dr. Ray Howe, a Chelsea, Michigan area orthodontist, to answer some of those questions. Dr. Howe, I'm coming to you for the first time. What can I expect?
So your child will come back and we'll take some photographs and one film showing the teeth, and then we'll all meet together in the consultation room. You'll come in, the child will be there, and I'll be there. I'll have you come over and stand by the chair, and then I'll take a look at your child's teeth and talk with you as I'm looking, so we'll kind of discover this together. And I'll look at several things. I'll look at the way the teeth come together. I'll look at the how crowded the teeth are, if they're crowded, if there's an overjet, crossbite. Those are the things I look for early on. And then I'll take, we call it a Bowley gauge, and I'll actually measure the teeth and measure the mouth. So from viewing the panoramic film and the measurements and direct observation, I'll have a really good idea of how things are going to develop and what needs to be done.
So after the exam and discussion, typically what's next then?
So every patient is different, and it would be impossible to describe what we do for every patient every time. But let's pretend that your daughter has crowding of her teeth, upper and lower, and she has an overjet, which means the top teeth stick out some from the bottom teeth. And let's say she's in what we call the mixed dentition stage. So she's got maybe 4 permanent teeth, top and bottom in the front, and 4 permanent teeth in the back, and the rest of the teeth are baby teeth. So what I would do is I would say, since there's dental crowding and since the arch is small, the mouth is too narrow, I'd recommend that we start with early expansion using a quad helix appliance, maybe a lip bumper on the bottom. Those appliances are designed to do the early expansion to kind of rough this thing in, but not that it's too early to straighten the teeth because the permanent teeth aren't there yet. So the first thing would be the expansion. Then once the permanent teeth arrive, we'll use full braces to line the teeth up and straighten them up. And that's when the overjet, that distance between upper and lower front teeth, that's when that gets addressed. So with the full braces on, we often hook up rubber bands from upper front to lower back to reduce the overjet, make the bite solid and even. Once all of that's done, then we take the braces off. We make retainers that are worn the very night that we take the braces off. And then from then on, you have removable retainers that are worn nighttime only.
Okay, Dr. Ray Howe, a Chelsea, Michigan area orthodontist, thanks for joining us today to discuss a little bit about what parents and prospective patients can expect to see when they go to an orthodontist. I'm Scott Gregg. Thanks for watching.